Hi, good afternoon. My name is Melisa Perez. Ms. Munoz, nice to meet you too. I'm going to go ahead and be the registered nurse that's going to be taking care of you today at this clinic in cooperation with your doctor, okay?
Okay.
So I'm going to go ahead and ask you how you would like to be addressed because I don't want to make you uncomfortable.
Miss Munoz is fine.
Ms. Munoz is fine?
Yes.
Alrighty, Ms. Munoz. Then, just so that you know, we're going to take 3 different steps. First, we're going to go ahead and just ask you general questions, see what the concern for your visit today is. Then we're going to go ahead and go to your actual medical history, and then we'll do a review of systems, which means I will ask you specific questions for specific parts of your body.
Okay.
Is that okay?
Yes.
All right. Ms. Munoz, I do need to let you know that my goal is to make you feel as comfortable as possible. I want you to be able to disclose anything with 100% confidence that whatever you say is going to remain confidential. Okay? It will only be shared with your doctor and anybody else that needs to know in the healthcare setting. Okay? I don't know if you have a family member or somebody waiting for you, but if anybody were to walk in, Ms. Munoz, I immediately will stop talking and I will look at you for direction. If you want me to continue with a health history, all you have to do is not yes. If you don't want me to, just not no, and I will escort them out. Okay? So let's go ahead and get started. Are you comfortable?
Yes.
Good. Okay, Mrs. Munoz, can you tell me your full name?
Lucy Munoz.
Okay. Your date of birth?
It's 5/17 of 64.
Okay. How old are you?
I'm 50.
And your occupation?
I'm an attendance clerk.
Good. Alrighty, Ms. Munoz. So tell me in your own words why you're visiting us today.
I have been feeling very tired, very stressed, and somewhat headaches.
Okay. And when is it that all of this began for you? When did you start experiencing this?
This began like 3 months ago.
Okay. Can you expand on that?
Could be because my mom is elderly. I
Okay.
live with her. She had eye surgery, and it's become hard working and taking care of her.
So you take care of
I
her
take care of her
all day or
at night,
at night?
mostly.
Mostly. Okay. So I'm guessing that you sometimes have to stay up and help her.
My sleep is interrupted because I have to keep watching her whenever she does not sleep. I feel that I have to, in case she falls.
Right. I understand. Um. So how is it that you handle this? How has this affected you? You alone, meaning socially or your own.
It's limited my social life, my work. Of course, I'm stressed. I get to work and I'm tired.
Has anybody in your family or your friends or coworkers noticed anything?
My coworkers notice in the morning, it's mainly in the morning, that I feel tired,
feel
I'm
tired?
drained, groggy.
Just it's a bad feeling.
It's bad.
So specifically when it happens, it's mostly in the morning. You're
It
saying.
happens in the morning, yes.
Can you explain to me what it feels like for you, the intensity? Maybe explain how tired you are.
I feel very tired, cannot concentrate with my work. It takes me a while to get into what I'm doing to feel better,
Okay.
but I am very stressed.
Very stressed. Is there anything that you've done that you've noticed either makes it worse or makes it better?
Napping before I actually go to sleep, go to bed. Reading, going to church. My daughter come pick me up and going out.
Okay. Anything that's made it worse, or it's pretty much stable?
Stable.
Stable. Okay. Are there any other symptoms that come along with the? I know you said tired and just
Headaches.
weak headaches. How often do you get the headaches?
I get headaches like maybe twice a week.
Twice a week. Can you show me where it hurts when you get the headache?
It's like a temple headache.
Okay.
Throbbing pain.
Throbbing. Does it radiate anywhere?
No.
No. How do you handle the symptoms? What do you do to make it?
I take Advil.
Advil? Okay. All right. So I'm going to go ahead and ask you, you're stating that sometimes your sleep is interrupted. Approximately how many hours do you sleep during the day?
I'm
The night, I'm sorry.
I'm sleeping like 5 hours during the week and maybe 6 to 8 during the weekend.
Okay. So 5 hours a day per week.
Per week.
And then 6 to 8 during the weekend.
Yes.
Okay. Do you notice any difference between the week and the weekend with the extra hours, or is it?
Well, because of work, I don't have to get up early, and it's less stressful.
I see. Okay. Alrighty, Ms. Munoz. So if I can just repeat everything just to make sure that I'm getting the same point across. So this happened or started happening about 3 months ago.
Right.
You take care of your elderly mother. Sometimes it's hard for you because you have to watch over her. Like you said, you're concerned that she's going to fall or an emergency happens and you're asleep.
Right.
Okay? And then when you feel the intensity of your symptoms, the tired, the fatigueness is usually during the morning. You feel groggy. And then there's a couple of times you get a headache, about 2 times out of the week.
Yes.
And you take Advil for that.
Right.
Correct? Am I missing anything or do you want to add anything?
No.
Okay. All right. So that pretty much covers the main reason you're here. Now I'm going to go ahead and cover your medical history just to make sure that we get every concept, and we're also going to cover your family history because we want to make sure that we catch any traits or any patterns. Okay? So can you tell me, do you have any medical diagnoses such as high blood pressure, high cholesterol, anything right now that's been currently diagnosed?
Past year, I was diagnosed with high cholesterol.
Okay.
And low vitamin D.
Low vitamin D. Okay. Alrighty. Any other present medical issues?
No.
No. No. Okay. What about for your cholesterol? Are you taking medication?
No medication. I'm trying to maintain my diet and exercise.
Good. That's good. So it's not too high then.
No.
Good. That's good. Any injuries, fractures, or surgical history during your adulthood?
I've had a hairline fracture to my right foot.
Okay.
And injuries to my ankles.
Okay, but no surgery.
No surgery.
Okay. Alrighty. Any functional limitations, and by this I mean, do you find any certain movement or position difficult?
No.
No, you're able to bend forward, backward, move side to side.
Yes.
Do you use any assistive devices such as like a cane or anything to walk?
No.
No. Oh, good. That's really good. Alrighty. Mrs. Munoz, as a child, any major illnesses that you have that you can recall?
I had hepatitis at age 3,
Mm-hmm.
which is hepatitis A, and I was anemic throughout my teenage years, and that's about all that I.
Did you ever have the varicella, the chicken pox?
Oh, and then chicken pox, yes, at age 5.
Okay, good, good, good. Any major injuries as a child? Did you ever get hurt?
No.
No broken bones?
No.
Okay. Now, like I told you, we're going to talk about your family because it's important to catch any traits, okay? So, any history pertaining to your mom, your dad, or your grandparents, you can expand on.
My mother, hypertension and thyroid issues,
Okay.
and eye surgery, which was from glaucoma causes.
Okay.
My dad, his cause of death was gallbladder issues.
How old was he?
My dad was 85.
85. Okay, I'm sorry to hear that. What about your grandparents? Do you recall anything?
My grandparents, for sure my grandma. My grandma had eye glaucoma when blind.
I'm guessing
Also,
from your mom's side?
my mom's side.
Excuse me. And your dad's side?
My dad's side mainly with stomach issues.
Okay, but you're not quite sure?
Not quite sure.
Okay. All right. What about your siblings, Mrs. Munoz? Any health issues that you've noticed?
I have 2 sisters that have diabetes and one that is in remission from ovarian cancer.
Any other form of cancer in your family?
No.
No? All right. Okay, Mrs. Munoz, we're going to go ahead and now cover any medications that you take on a daily basis.
No.
You don't take any medication?
No.
No? Okay. You mentioned low vitamin D. You don't take?
Oh, sorry. Take it
Okay.
back.
That's okay.
Vitamin D, 2,000 units a day.
Okay. Good. Any over-the-counter besides the Advil that you take? Any other over-the-counter medications?
No.
No. What about herbal or supplemental, like for dieting or anything?
No.
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 Okay, good. Any allergies to medications, Mrs. Munoz?
None that I know of.
How about to any food products?
No.
No. Environmental products such as grass, pollen, dust?
No.
No. Okay, so you've never had any form of allergic reaction?
No.
Good. If it's okay with you, Mrs. Munoz, I'm going to ask you a couple of personal questions, mostly to just assess your social life, make sure that everything is healthy there too.
Okay.
Is that okay with you?
Yes.
Okay. So, what is your marital status, Mrs. Munoz?
Divorced for the past 5 years.
Okay. Your living environment. I know you stated you live with your mom.
Mom.
Anybody else in the house?
It's just me, my mom, and my parrot.
Your parents. That's cute. What is your occupation, ma'am?
I'm an attendance clerk.
Okay. And how does your job make you feel? Does it stress you out
I'm
more?
very happy with my job.
You enjoy your job?
Yes.
Good. That's good. Your religious beliefs, ma'am, if you don't mind.
Catholic.
Now I need to stop here and just make sure that because of your religion or if there's any cultural differences that I'm not aware of, is there anything that I need to be aware of that perhaps you cannot do because of your religion or anything that maybe can affect your diet, such as certain foods that you can't eat?
No,
No?
none.
Nothing?
None.
Okay, good to know. Any issues with your diet? By diet, I mean, I know you're stating that you feel tired, you feel weak. Are you eating correctly?
Yes, I'm trying to maintain my nutritional dieting for my cholesterol.
Can you just kind of take me through a day of your diet log?
Morning, Cheerios, banana, and then like chicken, veggies, salads, lean meats throughout the day.
Okay. Good. So you try to
I
watch what
try.
you eat. That's good. That's what's important. Do you smoke, Mrs. Munoz?
No.
Alcohol intake?
No.
Okay, good. How about any habits such as by habits I mean like maybe a lot of caffeine, a lot of Coke.
No, I have 2 cups of coffee a day.
Okay, good. Um, do you have or have you ever had education on self-care concepts as far as breast examinations?
Yes.
How frequently do you practice it?
I figure, I guess I take three to two a month that I do check.
Okay, that's good. Um, now I do need to ask, and I apologize if it makes you uncomfortable. Are you currently sexually active now?
No.
No. Any sexual difficulties or anything that is abnormal in that area?
No.
No. No. Have you had a pap smear in the past?
Yes, past yearly,
Year?
past year.
Okay, and no issues right now. No discharge.
No
Nothing.
issues. No.
Good. All right. Now that completes that second part. Now, like I stated earlier, we're going to go ahead and do a review of systems. So I'm just going to ask you a series of questions. I'm sorry if they're repetitive, but it's just checking certain body systems, okay? The first one is going to be just general. Do you feel, I know you say tired, so fatigue is obviously checked, but any dizziness, any night sweats, fever?
No.
No? Okay, good. Any pain, Mrs. Munoz, right now?
No.
No? No pain?
No pain.
Okay. What about your skin? Have you noticed any abnormal rash or changes in color of your skin?
Somewhat a little dryness in my arm.
Okay, so nothing
Nothing
abnormal.
else. No.
Okay. What about your hair? Any significant losses of hair?
No.
No? Your nails, ma'am, both toenails and fingernails, any thinning or fungal issues?
No.
Okay, good. Now to your head. I know you state frequent headaches, but anything else like dizziness, fainting spells, or loss of consciousness ever?
No.
Okay, good. Excuse me. What about your eyes, Mrs. Munoz? I know you state that your mom and your grandmother have issues with glaucoma. When was your last eye exam?
My last exam was 3 years ago.
3 years ago. So maybe we need to schedule for you.
Yes.
Okay, we will. Have you noticed any changes in your vision?
Blurry vision.
Okay. Is it pretty severe, or is it just when you're like tired and you're kind of
More
working
when
on the
I'm
computer?
reading.
Reading. Any issues with driving?
No.
Good. Okay, Mrs. Munoz. How about any constant tearing?
No.
No? Good. Good, good, good. We're going to go ahead and go on to your ears. Any issues with your hearing? Have you noticed a significant loss or difficulty?
No.
How about ringing in the ears?
No.
No discharge or pain from the ear?
No.
Good. Onto your nose, Mrs. Munoz. Any difficulty with breathing?
No.
No. You don't feel any obstruction?
No.
Okay. Any difficulty with smell? Can you recognize scents pretty well?
Yes.
How about congestion? Any frequent sinus infections or colds?
No.
No. Allergies? No.
No.
Good. Alrighty. Onto your throat and mouth. Do you constantly have sore throat?
No.
No. Any issues with swallowing where you feel that it's difficult to pass saliva or food?
No.
Okay, good. As far as your gums and your teeth go, any abnormal swelling, bleeding,
No.
ulcers, anything? No. When was your last dental appointment?
A year ago.
A year ago? And everything checked?
Everything's fine.
Good. Now, I'm going to ask you, do you have any swelling or tenderness when you touch yourself anytime on your neck or under your axillary areas when you're doing your exam?
No.
No? Okay, good. And the reason I'm asking is because that's where we have our lymph nodes. So I just
Right.
want to make sure that you're not having any issues with that. Now, onto your chest and your lungs. Any difficulty or pain when you breathe?
No.
No. Any difficulty when you're laying down in bed? Do you feel like you're gasping for air and you have to sit up?
No.
Good. Any wheezing?
No.
Cough or sputum production?
No.
Good. Onto your breast, I know that we stated that you do breast exams. Have you ever recently, within the last time that you checked, noticed any changes in the color of the area, any abnormal texture or lumps?
No.
No. Okay. And you said the last one was 2 months ago? Almost 2 or 3 months
Yes.
ago? Okay. Onto your heart, Mrs. Munoz. No hypertension, correct?
No.
Um, any chest pain?
No.
No palpitations?
No.
No. Do you notice any inability to exercise? I don't know if you exercise, but even walking up the stairs, are you able to complete that, or does
I'm
it
fine.
feel? No, you're
Fine.
fine. When was the last time you had a EKG or cardiac?
Never had a
Never.
cardiac test.
Okay, so that's definitely something we're gonna
Yes.
schedule for you. Okay. Uh, Now we're gonna talk about your actual circulation. Okay. Um, Usually when we have poor circulation, you'll feel tingling in your legs, especially when you're standing for quite a long time, or you'll feel like a heavy feeling. Do you have any of that?
No. No
No.
tingling. Somewhat a little swelling to my ankles, but that's all.
Okay, and the ankles, is that something that you've had
It's
previously?
previous injuries. I have.
Okay. What kind of injuries?
Sprained ankles.
Just sprained ankles, but no
No,
fractures, right?
no.
Because we covered that.
No.
Okay. All right, just wanted to make sure.
Okay.
Hematological, meaning your actual blood flow. Do you notice any abnormal bruising in your body where you don't remember hitting yourself?
No.
No? How about any abnormal bleeding in actual stool or when you urinate?
No.
Nothing like that?
No.
Okay, good. And you stated that you were anemic as an adolescent,
Yes.
but you haven't had anemia since?
No.
When was the last time you had lab work?
A year ago.
Okay, so we'll check that as well for you.
Okay.
Okay. For your stomach, I know we talked about your diet already. Do you have any intolerances to any certain foods that you notice just don't go well with your stomach?
Milk and ice cream.
Nothing else?
More than anything.
Okay. What is it that it does? It just upsets it?
Upsets.
No loose stools or anything like that?
No.
Okay. Are you pretty regular with your bowel movement?
Yes.
About every
day, every other day.
Good. You denied any blood in your stool, right? You've never
Right.
seen blood? Okay. Any issues with your appetite sometimes? Or you're pretty much constant?
No. I'm fine.
Okay. Any issues with hemorrhoids?
No.
Any issues with indigestion?
A little bit.
A little bit.
Heartburn.
Okay, yes, heartburn. When do you get the heartburn?
Not often, but it depends on what I eat.
Okay, mostly with what kind of food?
Spicy food.
Spicy food. Okay, excuse me, I'm sorry. Have you ever had a colonoscopy or an endoscopy when they put a tube down your throat?
I had an two endoscopies already.
Okay, when was the last
About 3 years ago.
Have you ever had a colonoscopy where they go through the rectum? No. Okay. Oh, just checking. Okay, Mrs. Munoz. Now, you stated that your mother has a history of thyroid, correct?
Yes.
Have you ever noticed, Mrs. Munoz, when you look at yourself in the mirror, like a bulging neck?
No.
No? Have you ever noticed any pain
No pain.
or tenderness when you touch?
No.
No? Okay. What about intolerances to heat and cold? You're very sensitive
Cold.
to the cold?
Yes.
Okay, good. Any changes in your weight that you can say kind of don't match up to what you're doing?
I maintain.
You've maintained
my weight.
Good. As far as hunger, Mrs. Munoz, is it constant?
No.
No. You don't have frequent thirst where you feel it's not quenched by anything?
No.
Frequent urination?
No.
Good. Okay. Any issues with urinary retention, meaning that you're not able to go when you have to go?
No.
No. Any issues with waking up at night having to go urinate?
No.
Frequently?
No.
How about stress incontinence? By this I mean when you sneeze or cough, sometimes you feel a little bit of urine drip out.
Neither.
Any hernias?
No.
Any pain to the lower abdominal wall area?
No.
No. And lastly, have you ever been diagnosed with a sexually transmitted infection?
No.
As far as your muscles and your joints go, I know you stated that you've had sprained ankles and they're kind of sore sometimes. Any other joint issues or pain
about all.
You never wake up with a stiff wrist or
No.
swelling?
No.
Nothing? Okay, good. Um, how about history of seizures, Mrs. Munoz?
No.
No. Have you ever had issues with coordination to where your brain tells your body to move, but you can't really get it there?
No.
Any tremors that are
No.
unexplained? No. Okay. And never loss of memory? You never have difficulty remembering?
No.
Good. Uh, Now we're going to do a little bit of psychological review just to make sure that everything is checked there as well. Can you tell me if you have any mood changes to where you can't explain why you're acting a certain way?
A little bit, somewhat of mood change, but I guess it's because of the stress.
Right.
But not like excessive.
Not excessive to
No.
where you can go from happy to sad?
No.
No? Okay. How about suicidal thoughts?
No.
No? Do you feel that you are depressed right now?
No.
Okay. Difficulty with staying asleep or falling asleep. I know that because of your mom, you're watching over her, but when you actually do get the chance to rest,
No. Once I go to bed and I know that I'm resting, I will go to sleep.
okay. Now onto menstrual cycles. When was it that you began your menstrual cycle? At what age?
Age 12?
12.
Mm-hmm.
And when did you hit? Did you hit menopause?
Yes.
At what age?
Age 48?
Age 48.
Mm-hmm.
Any issues with that?
No.
Okay. And I know we covered this already, but I just have to recheck. Any issues with your sexuality that you want to discuss? Anything that maybe is concerning you in that aspect?
No.
No? Okay. As far as pregnancies, Ms. Munoz, how many pregnancies?
Total of 4?
Total of 4. And children?
1.
1. And the other 3?
Miscarriages.
Miscarriages. I'm so sorry. Okay, Mrs. Munoz, well, it seems to be that we've pretty much completed every system. Is there anything that you feel that you need to cover again or any questions you have for me?
No, I have no questions.
No questions. Is there anything that you would like to add before I close off the assessment?
No, I'm just here for my concern.
Your concern. Okay, so I'm just going to repeat everything. You definitely want to get checked. You want to make sure you get your lab work checked, correct?
Yes.
You're feeling tired and weak. You want to know the reason why. You
Right.
think it's stress, but you just want to double check.
Double check, yes.
Okay, Mrs. Munoz. Then what I'm going to do is go ahead and write up a report to the doctor, and then we both will come in, and he'll do what is a physical exam and generally check every part of your body. If you think of any questions or you have any concerns when we're walking in, please feel free to direct them. Okay? All right. It was a pleasure meeting you, and I will see you shortly.
Thank you so much for
You're
your time.
welcome. Thank you, ma'am.
Thank you.